Good morning. My name is Donald Dew. I'm President and CEO of Habilitative Systems, Inc. I'm so happy to follow the sheriff because, you know, we in our audience today we have Ms. Sharita Logan, who's a representative from Congressman Davis's office. And as we all know, the congressman passed landmark legislation around the Second Chance Act, which brought so many persons who are institutionalized and incarcerated, in large part due to issues struggling with substance abuse and mental illness, brought them home and gave them a second chance. So we really appreciate the congressman with that legislation, and certainly our Department of Correctional officials. We know that the congressman was also working with Director Jeffries at the Department of Corrections in a number of different efforts. So we really applaud these efforts. It's fabulous, really, really great. Governor Pritzker, thank you so much. This state overdose action plan is so critical, so important to our community. And, you know, it's the kind of thing that talks about in one form or another the power of possibility. You know, when people come together, you know, it's really indicative of what can happen in terms of, you know, impact in the community. Our governor has continually demonstrated the power of possibility and collaboration, and we're so pleased about that. You know, our governor has created the healthcare transformation collaboratives, creating statewide issues around healthcare, dealing with issues around healthcare disparities and institutional racism, and he understands very, very clearly that once again, this SOAP strategy is going to bring people together in a very meaningful way. And let me just step back for a moment and talk about why it's important that we're here today in this particular facility. We also have with us today Israel Roca, the CEO of Cook County Health. You know, they were responsible for creating the funding several years ago for us to transform this facility from a Ameritech bill payment center. Can you all imagine that? This used to be a Ameritech bill. Some of you all may be old enough to remember that. All right, we used to come right here and pay our bills, right? But you know, this place was transformed, right? Right here to create opportunities, as my colleague and co-developer of this Westside Community Triage and Wellness Center, Dr. Safir, illustrated. But the very first thing that we did out the gate, Governor, was we dealt with the opioid crisis. We went into the streets and we began screening and ensuring that folks who are suffering and in pain from opioid addiction and severe mental illness knew that there was a resource available here on the west side of Chicago. You know, Habilitative Systems has been serving the west side of Chicago since 1978. People with disabilities, people with mental illness, substance abuse, all these persons in pain have been receiving these vital services. And we are only in existence because of collaboration, because of support. We started out at Clare Christian United Methodist Church, part of their community ministry. People are saying now more than ever before, we have got to come together. If we don't come together to make change happen, it's not going to happen. And it's our watch right now, ladies and gentlemen. It's our watch. It's about what we do with our time right now. I'm so happy that the governor, for example, in Census 2020, I got to say it, Governor, you did it. You know, when we were talking about Black Lives Matter, the governor put money behind the effort and said, let me get it correctly. Let me do the right thing. He said everybody counts in the state of Illinois. And he put all kind of money out here to make sure that people were counted. Secretary Holt, through the Department of Health, Department of Human Services, led the charge. HSI was able to be the lead agency with 30 different organizations. 8 communities were served and impacted on the south side, another 5 on the west side. 13 community areas were served and counted in the census. But guess what? It was, again, the power of collaboration. And what we did, very interestingly enough, during that time, Secretary Holt knows it very well, is that we engaged in social determinants of health screening. And yes, we were able to find out during that time, Mr. Governor, that several people that we were trying to get counted were in fact suffering from opioid addiction, suffering from mental illness. And we were able to get thousands of people referred to vital human services, and they did not have to show up in institutions, they did not have to show up in emergency rooms, they did not have to show up in correctional facilities, because we were able to screen them and make sure that they got the basic fundamental message that they in fact do count. They do count. So the time has come. You know, Reverend Dr. Martin Luther King said we have to have a fierce urgency of now. Our governor understands he can't wait. He can't wait. He's got to do it now. He's got a masterful team, administrative team, making it happen. We've got elected officials making it happen at every level of government. So we are so pleased. I'm so happy to be serving at this point in my life. You know, if anybody told me that little boy from the west side of Chicago could, you know, just collaborate, just to help create and just take advantage of unique opportunities like this, I wouldn't have thought it possible. But it's possible right now, right here, right now, y'all. So as providers, let me just say, that we are standing here poised, Mr. Governor. We thank you for your vision. We thank you for your passion. And we thank you for your commitment to the underserved people of the state of Illinois. We're going to make this happen, and we're going to impact opioid addiction in our communities. Thank you all so much.